Hey, it's Dr. Chris Googles here from Square One, and today I want to talk to you about some things you need to be aware of if you're in a car crash. And first of all, not everyone that gets in a car crash is injured, and not everyone that's injured has permanent problems. However, we know that 50% of people that are injured in car crash end up developing chronic pain, which means they never fully recover. And there's a lot of different papers that have come out over the years talking about some of the different prognostic factors. Prognostic factors are things that help us predict the likelihood someone's going to recover. And some of these things are more important to doctors, but there's a few things that all patients should be aware of. And there's a couple of different papers that I'm going to talk about. One's by Walton and his crew, another one's by a guy named Sterling and his crew. And there was a few things that they talked about that are high predictors of poor recovery, meaning if you have these things, the odds of you fully recovering are not that great. One of those is if you have a headache at the moment of a crash. You're in a crash and you get a headache almost immediately onset afterwards. That's a high predictor that you could have a poor recovery. Another one is if you have back pain at onset, meaning you have a crash and you almost have immediate back pain, that's another high predictor that you may have a poor recovery. Probably the best ones though is initial pain, neck pain levels. Now there's a couple different ways we can measure neck pain. One that a lot of patients are familiar with is if you rate your neck pain on a scale of 1 to 10 on what's called a visual analog scale. The doctor has you rate your pain levels on a scale of 1 to 10. If your initial neck pain is like a 5.5 or higher, that's a really high predictor of poor recovery. Or if they have you fill out some forms that rates your disability, there's certain numbers. And for doctors that they're watching, if your neck disability index is greater than a 29 on initially with a patient with neck initially after a car crash, that's a high predictor of poor recovery. The reason I point this out is the most important healing process is at the beginning of treatment. When you're in a car crash, the most common injuries are soft tissue injuries. So when you get a soft tissue injuries, your body goes through 3 different phases. You have an initial inflammatory phase, that's about 1 to 3 days. And then you go through a proliferation phase where your body is actually laying down new collagen. And collagen is what is the protein your body uses in your ligaments to hold your bones together. And that only lasts about a week to 6 to 8 weeks maybe. And that's the most important phase in healing. So if you have some of these symptoms, first of all, everyone should get checked after a car crash, no matter what your initial symptoms, to see if you may be injured. But if you have a headache right after the crash, if you have a low back pain right after the crash, or if you have moderate to high neck pain levels right after the crash, those are high predictors that you may be an at-risk person for not having a great recovery. So especially if you have those things, make sure you get in to see an expert at treating someone that's involved in a whiplash-related trauma to get evaluated to see if you have any injuries, and if you do, what you can do to start the healing process right away to increase your odds of full recovery. So I'm Dr. Chris from Square One. Please share this video with anyone that you know that has been in a crash and may be suffering from these symptoms and may be in need of some good quality care.